My name is Jenna Norton. I am an NIH Program Officer, but speaking here in my personal capacity. I'm also a signer and organizer of the Bethesda Declaration, which was a letter of dissent about harmful and unethical and unlawful changes we were seeing inside the National Institutes of Health over the past many months. I'm also a public health scientist. I focus on racial, ethnic, and socioeconomic disparities in chronic kidney disease, as well as in urologic conditions. So the Bethesda Declaration was a letter of concern that was ultimately signed by more than 600 NIH staff, and it was modeled after something called the Great Barrington Declaration. And so going into the backstory here, the current director of the National Institutes of Health, his name is Jay Bhattacharya, he issued this Great Barrington Declaration during COVID, and it was a dissent around the prevailing public health policies that were attempting to mitigate the spread, slow the spread of COVID-19. When Jay Bhattacharya was appointed as director of the NIH, I think a lot of us were actually cautiously optimistic that he would come in and correct a lot of the harmful, unlawful, and unethical policies we had seen pretty much straight away under the Trump administration. And he didn't. And so we thought we would offer our dissent to Jay Bhattacharya. This public letter was a way of letting folks know, these harms that we were seeing inside the NIH, but as scientists and staff at the Institute weren't able to stop. When the Trump administration came in, there was an immediate halt to pretty much everything we did at NIH. We weren't allowed to talk to our grantees. All grants stopped going out. I've never seen, a pause like this around a transition in administrations. Then we started having grants terminated from above. We called them drone strikes because it felt like it was coming out of nowhere, and program officers would not even know in advance that the grant was getting terminated. We were clearly not involved in any decision making that went into terminating these grants, and that should be our job. The patterns of the terminations quickly became apparent, especially in light of the executive orders that were basically limiting the acknowledgement of transgender people, also intersex people for the record, prohibiting DEI in NIH in any federal funded space. And so it was, research addressing health disparities, health equity, structural racism. All of this was just getting terminated from above. And then we started getting messaging that we as program staff had to actually start categorizing research based on whether it aligned with agency priorities. And we got very nebulous guidance on what agency priorities really meant, how this should apply to health disparities research, which we were told was legitimate, despite the fact that much of it was being terminated. And so a lot of folks sort of looked at this and said, well, we're cutting off the finger to save the hand. And so that's when civil servants started being the ones to actually carry out the censorship. The fear of being fired, of having, not being able to fund any science at all, kept a lot of people in check. I can remember sitting in meetings and trying to argue for the validity of the type of research that I oversee and do, the validity of health disparities research. For a long time, we weren't allowed to put out any research that focused on minority populations. So if you had a study that was looking exclusively at, Black women or Black people in general, which is really actually important to do in my area because the health disparities in kidney disease are just so substantial. Black Americans have like 4 times the rate of progressing to end-stage kidney disease, to kidney failure, compared to white Americans. And so we need to be able to address their unique needs to resolve those disparities, and we weren't allowed to do that.
I see. Bhattacharya has kind of claimed that DEI in science is against the mission of the NIH. I was wondering if you could give your take on why diversity in science is useful and relevant and supports the mission of the NIH, which is to improve the health of Americans.
So traditionally, historically, when we talked about DEI, it was largely focused on workforce issues. But the administration also seems to be applying DEI to health disparities, health equity, and minority health, which all kind of look at disparities along racial and ethnic lines and gender lines that we see in health outcomes. What is the makeup of the people who are participating in a given study? And we know that when we do research only on white men, we end up with findings that actually don't apply to everybody else, right? Because there are differences in biology between men and women that need to be addressed. When we don't cast a wide net to ensure that we are getting diverse participants into our studies, we miss things. We miss important information that helps us actually understand the whole spectrum of human genetics and human biology that drive health outcomes. We know racial and ethnic minority groups are underrepresented in research studies. You know, I would be speculating if I were to say why Bhattacharya has a different view than I do. I personally do not believe he's acting in good faith. I don't think he actually has science to back up the claims he's making. You know, one of the things that this administration has said in their attack on DEI is that DEI studies are actually harmful. And the question I always want to put out there is harmful to whom?
Why do you think you were put on administrative leave, and why do you think you were recently brought back?
So I was placed on administrative leave on the first day back from the government shutdown on November 13th in 2025. I don't know for certain why I was put on leave, at least not through official channels. The notice that I received said, you know, basically you're being placed on administrative leave. This is not disciplinary, with no further information about how long it would last or, you know, why. Jay Bhattacharya, as well as an anonymous HHS official, then went to the press. The HHS official said that I was placed on leave because I was criticizing Donald Trump when I should have been working. And Jay Bhattacharya in the press said that I was put on leave because this was actually the second time that I had been investigated by the NIH for violating the Anti-Deficiency Act. And so what I want to make clear is that, to my knowledge, I have never been investigated by the NIH, not with this administrative leave experience and not in any prior experience. I also checked with my direct supervisor and my HR person, and they had never heard of me being investigated for anything. And so I don't know where he got this information or why he felt he should comment on it publicly, which is also sort of a violation of procedure. So those are my sort of clues as to why I was put on leave. I believe it was because I had been speaking up about the harmful policies that I and many others have seen inside the National Institutes of Health. You know, I was a co-leader and organizer of the Bethesda Declaration that we did in June of last year, although nobody else who signed that publicly was placed on leave. But I also did continue to speak up in many other venues. I was on MSNBC and ABC and started to get more public attention around speaking up. And so I don't know if it was one single thing that I did that pushed them over the edge, or, you know, if it was the perception of me as a primary driver of the Bethesda Declaration that caused it, or something else entirely. So I think free speech is first very important in science. I think that free speech has been a little bit weaponized in the current environment to suggest that you have free speech if you agree with me. You don't have free speech if you do not agree with me. In terms of civil servants and being able to have free speech, I mean, free speech is a fundamental human right, and it was enshrined in our Constitution because I think that our founding fathers understood the consequences of what can happen when a government starts to constrain free speech, and that is democracy collapses. So in other words, free speech isn't about protecting any individual who is freely speaking. It is about protecting our country and protecting our democracy and making sure that the everyday person can't be silenced by these big powers. And so whistleblowing laws are what protect the workers to be able to speak up when we see something wrong.
I wanted to get a little more granular with some of the changes at the NIH that you had mentioned. So the NIH terminated top-scoring grants to scientists from underrepresented backgrounds while maintaining grants from standard pathways. Can you talk a little bit about what that claim means?
What happened in this case is that NIH recognized that people from certain backgrounds are underrepresented in the research workforce. And so they set up an opportunity to apply for that specific population. And then they went into the same peer review process, the same programmatic review process, and the same vetting by council. And what this administration did is, just because they had applied via that invitation, all of their studies got terminated. Even if they had outperformed and outscored people who came in through the standard pathway. They were not given any special consideration. These people basically had their research terminated because they came from an underrepresented background, even though they had outcompeted their peers.
So you had posted something about text analysis, kind of AI tool that's being employed by NIH to evaluate grants before the funding goes through. And I was wondering if you could comment, if you're comfortable commenting, about what you think that this tool is and what it does, and if you have any objections to it.
Yes. So we've actually seen this type of keyword-based screening happening at NIH for, probably over a year now. NIH actually formalized this as policy in December of 2025, and they put out guidance. It's been published by Science if you want to read it directly, but it basically says that there is a computational text analysis tool that screens for terms potentially associated with the misalignment of agency priorities. And it's just about the most Orwellian way possible, I think, to say banned words. Program officers like me will get a spreadsheet of grants that have gotten picked up by this tool. People are being explicitly told, don't bother pushing back against the tool, just change the words and get the science out. And so it does effectively become straight up censorship.
Are there any broad lessons and takeaways about NIH and what you think the future of science should be for the best possible health outcomes for Americans?
The last thing I would want to convey is that science should be done in ways where it's not constrained by partisan political beliefs. Scientists should be able to ask whatever questions they, alongside patients and members of communities that are affected with diseases, deem important and appropriate and meritorious. And having politicians come in and tell us that there are certain things that we can't study isn't going to make our public healthier. It's going to cut off important areas of research. NIH is a way for us to get answers to the questions that help us understand how to be healthy as a society. And the more we constrain that, the more incomplete our answers will be. And then the other thing that I would just like to leave with is that we, I think, have a responsibility to our country to civically engage. And I think we've fallen under the impression that engaging civically is either ineffective, not worth our time, nobody's going to listen anyway, or inappropriate, like a scientist, we don't want to get involved in politics. But I think that's an abdication of responsibility, and I think it's a self-fulfilling prophecy. The moment we step back and stop engaging is the moment that somebody else decides what happens. But also, more broadly, I think all Americans should be participating because we're each expert in our own areas, in our own realms, in our own experiences. And if we want those brought to bear in the policy directions that our country takes, we have to show up and we have to speak up and we have to engage.